Hello, fellow pet lovers. How in the world are you? Today, we're going to talk about coronavirus and what it means for you and your pet.
Thank you all for joining me today. We're going to explore areas of just what is this coronavirus? Can our pets get it? What can we do about it? What I'm doing about it in my office? And the new social distancing, what does it mean for us? Is it the new normal for us and our dogs and our cats? What's in the future? And we're going to go into questions and answers. But before we do,
Please take a moment to subscribe. Hit the little subscribe button below. There's also a bell somewhere below. You'll be able to get notifications whenever I post a new YouTube video that way. Can our pets get coronavirus? I think that's the biggest question everybody has on their mind. The short version is, I don't think our dogs and cats are at risk at all. Can I be 100% sure of that for 100% of the next days? No. But every evidence that we have supports the fact that our pets are not going to get this condition. Coronavirus is classified by the CDC as an emerging disease. An emerging disease is a condition that, how do we want to say it? It comes out of nowhere. No one knew about it before someone discovered it. Zika, for example, was an emerging disease. The CDC has various well-established protocols in place to identify and to react to positively and try to contain or control emerging diseases as they come out. And they've been reacting, obviously, in the best manner that they can to combat the type of situation that we're at. By definition, emerging disease means we don't know enough about it to say everything is 100% factual. So the CDC's recommendation is to use caution, wash your hands after you play with your pets. After you touch your pets, you should wash your hands and the like. I think that's common sense. Do I do that with my dogs and cats every time when I'm home and I know they haven't been anywhere and they haven't been in contact with anybody that's sick? No. Is that good advice for you? I probably shouldn't tell you what I do, but that's exactly what I do. I'm really interested in how you guys are acting and reacting, particularly the dog owners. I know I don't have 100% dog owners here. I got a couple really insights for the kitties in a second. But dog people, are you out walking your dogs right now? Are you getting good fresh air? And you're taking your dogs with you? You could let me know what your status is. I'd appreciate that. Let me give you a real world example. Right now, well, let's say before all of this occurred, you walk down the street or whatsoever, you see somebody, you say, hi, how are you? Blah, blah, blah. Oh, I forgot my phone. Can I use your phone to call my wife to pick me up at the corner? Whatsoever. When you give them the phone, they give you your phone back. Would you do that today? Would you do that today? Would you give someone your cell phone and take it back and put it in your pocket without thinking, I wonder if there's cooties on this phone. I wonder if there's coronavirus on this phone. I wonder if there's cold virus or influenza virus. You know, the model for transmission of this disease is identical to flu and colds. It is aerosol, but the 6-foot guidelines are that it's going to drop 6 feet away and end up on the ground or maybe on your shoes. I'm right now when I go home, I'm basically using level, I don't remember what it was. In school, I remember what level it was. Disinfection procedures. I'm basically showering into the house, take my clothes off in the garage, shower, and then change clothes and go in. I obviously not being at work probably have more contact than anybody else in shelter in place. But the family, my wife's at high risk. We're all at high risk. I'm not quite sure anybody's at low risk with this. But that's what I'm doing when I get home. And after that, we play with the dogs and do what we want. From the standpoint of what you do out. So my guess is, if you start thinking about it, hey, I don't want to, I'm quite sure I want to hand somebody my cell phone, let alone take it back and put it in my pocket before I soak it in alcohol for a half an hour. So you're walking down the street with your dog. I am. I'm still what we walked last weekend with the dogs and got out of the house. It's our Sunday, Monday morning constitutional, and that's what we do. And I'm going to plan on doing that this weekend too. But if I meet a stranger and they want to pet the dog, my thought is the dog's not much different than the cell phone. I don't want them saying hi to him if I don't know what their risk status is, and the stranger down the street, I don't know from Adam. So I think social distancing for our dogs is certainly during the shelter in place orders. I think it should be affected for our own dogs and cats. Um, what about visitors coming to your house? Um, visitors coming to your house, I think, are kind of the same way. I mean, you're going to know how much you trust them if they're really good friends and they've been in shelter in place and they're coming over, and that probably is illegal right now. I've made these notes and thoughts before the order last night about everybody's in shelter in place. So maybe it's illegal for you to come over and visit your friend. I don't know. But let's say you do. Um, maybe the dog should be somewhere else before. If you use, social distancing and 6 feet when you have a chat with your friend, or maybe you'll have a chat with your friend on the front porch, or however that works. Maybe the dogs and cats shouldn't engage with them. Maybe you should bathe them after they really have a thing. What happens if your dog or cat gets loose, goes to the shelter, you bring it home? Well, the first thing I do is I'd pop it in the tub and give it a good bath. I think I'd do that no matter what, but with this risk of where the dog's been and who's been handling it and whatsoever, same thing for kitties and the like. If they find a way to the shelter, they should find their way to the bathtub before they find their way to your house. I threw up this screen, this note from the AVMA. The CDC, as we talked about, the recommendation is wash your hands between your pets. AVMA really, I'm not sure I like the word fine-tuned, but really added a whole bunch of stuff to this with the emphasis on um, primarily working dogs and the like. But they want you to limit contact. If you got a CVD person that's actually being treated in the house, they shouldn't contact the dog. That makes sense based upon just everything we've been talking about. And someone else should be walking them and feeding them and the like. One comment that I want to make about an early press release about an individual in China that had CVD, was being treated for the CVD, and he had a dog. The dog was tested. The dog was tested positive. Dog tested positive on nasal swabs, is my understanding from what I've been able to read from the reports coming out of China. The dog wasn't ill. The dog never became ill. The dog wasn't ill. The dog never became ill. So what's your comment? What's your take on that? Does anybody think that that's a good sign, a really dangerous sign, or somewhere in between? I needed a sip of water. The team's making me coffee, so I have to drink water right now. So I think that's really a good sign. I think it supports my cell phone example of droplets can definitely get on anything: a pencil, a pen, your cell phone, your pet sitting on your lap. If you're exuding any type of viral particles, whether it's influenza or corona, but certainly you that dog didn't get sick, and what's more important, I don't think our pets are going to get sick. A news release that came out from IDEX, our veterinary laboratory, which is one of the two huge laboratories across the United States that does a lot of innovative development for my profession and you and your pets, actually. So we really are indebted to them. They have a canine coronavirus CVD ID 19 test. And that test, they said they will make it commercially available if there's a need for it. But what they've been doing behind the scenes is and what they do this like with heartworm. If my practice runs 100 blood samples, a percentage of them will have been requested for heartworms. And believe it or not, statistically, I may be not 100% correct with this, but they actually test all of those for heartworms and report it to the American Veterinary Heartworm Society research, whatever, to get statistics on heartworm spread and the like. They're doing that with Ehrlichia, and they're doing that with several other diseases that are migrating in, particularly in our area from Mexico. Ehrlichia is a big problem as it's migrating. If you live down on the other side of TJ, you probably have a good chance of picking up Ehrlichia. Anyway, so that dog in China, I think it's good news that yes, droplets can land on it, but no, the dog can't get sick. And there are no dogs that are tested by IDEX. I think they've got 1,000 tests so far that have turned up any positives whatsoever. So briefly on terminology, what is this coronavirus? Well, we were dealing with SARS CoV-2, which is now called COVID-19. 19 is for 2019. That slide's wrong, by the way. It was first came out in November 2019. That's why it's COVID-19. Can't type or can't think, one of the two. So what was CoV-1, you might ask? Well, what's SARS, you might ask? SARS is suddenly acquired respiratory disease syndrome in people. And SARS coronavirus 1 was out of China, almost identical flight path to what we're seeing right now. The fish markets with the animal markets on top of them, bat virus intermingling with the crowded mammal unsanitary conditions produced the SARS CoV-1, went through the Chinese population, knocked out a bunch of people, unfortunately. China was relatively slow in reporting it, but for whatever reason, the public health officials and the like, it died out very quickly. There were scattered cases across the world, but not an extreme thing, and it really died out in, I think, like 6 or 9 months. And when they discovered the coronavirus 2 in the same conditions, I think the early feeling was that, wow, it might just do the same thing, explode for a couple months, not take out too many things, and just kind of die out. And by the time the first, it's my understanding that it was first documented in China in November 2019. And the first reports of it actually were leaked out. I think China wasn't exactly forthwith with their epidemiological data. It was almost Christmas time in 2019. And by then there were cases that were all over the place. And we got that glop of, there were cases already in the United States, and there was that glop of Chinese ambassadors, or I don't know, that came over on a flight, and the government decided they were going to quarantine them on an Air Force base, I think, and that was pretty much the start of the explosion that we're dealing with right now. And Unfortunately, the number 2 version doesn't seem to want to die out yet. Um, Time will tell. We've got the self-quarantining things in place. Don't think of coronavirus as being a very novel type thing. Dogs have 2 or 3 upper respiratory coronaviruses that are minor. They are not contagious to cats. They are not contagious to you. All of these coronaviruses I'm going to talk about with dogs and cats and other mammals are very species specific. They don't go from dog to cat or dog to cow or people or whatsoever. There's a canine intestinal one that's been around for ages. It's relatively minor. It's not in our area. It used to be. There's actually a vaccine for that. Um, the um, the We don't currently use the vaccine, but we'll recommend it if you travel into an area. It's not the same thing as what you're fighting if you go out in the street and somebody coughs on you at alpha beta. Alpha beta is gone. Oh well. Um, Memory lapse there. So there are several strains of upper respiratory coronavirus in people. They basically produce a bad cold, nothing worse. The feline has an intestinal coronaviruses, which is pretty mild but produces chronic diarrhea. And of course, the feline infectious peritonitis virus, which is a nasty virus, is also a coronavirus. Most mammals have them. And like I said, they're all very, very species specific. People have asked us what we're doing at the hospital. I published this on the website. I'm not going to go through all these little things, but basically, our normal sanitary effects have gone overboard. Being open to the public, we've implemented the social distancing practices. But one thing we're doing is that we are open. Veterinary hospitals are essential services. As you might know, for this last week with people with dogs with coughs and colds that they were worried about, diarrhea problems, broken toe problems. Our pets certainly need good care in this time of crisis. But things are not the same. We're continuing to provide all necessary services that we can. And I think we need to kind of look at the preventative care aspects intelligently and actually more dramatically, because as things develop, good preventative care could be a very big source of not having problems and not needing to come into the house or come out of the house and create problems that let me say it a different way. You might not have to come out of the house if the dog is healthy because there's no need to. Some really strange things for me and very difficult things. I mean, I walk in the exam room, I have to shake someone's hand. A large number of clients through generations of puppies and a few other things I hug. I guess that's gone, at least for a while. We're initiated what we're calling curbside service. If you come in with a pet for XYZ, you can remain outside. We'll bring the kid inside. We'll either chat with you on phone or I'll stand 6 or 200 feet apart and shout, and we can chat in the parking lot. Some type of procedures like that seem to be working pretty well. It slows things down, but that's not the point, because maintaining safety is our primary concern for you and for our pets. That we're going to continue and fine tune as we need to. I have no idea how long this is going to last. I don't think anybody has any long idea to last. The president's first message was 15 days. The current order that we got last night in California was until further notice. What that all means, only time will tell. Um, one of the reasons that I think that, let me slide this up so I can see it better. Preventative care is more important now than ever, is that patients that need medication or refills, if they're current on their examination, i.e. within the last 6 or 12 months, refills become pretty easy. Well, talking about, I think I got a slide about this later, but medication refills are easy if the patient's current, shall we say, becomes difficult if Fido needs heartworm medication or flea control and they haven't been in too long of a period of time. The major thing that I've been toying with for over the last 4 or 5 or 6 months, and it now just becomes blatantly obvious that thinking about it is no longer an option. We're actually going to implement the first stage of this next week is telemedicine. Telemedicine is well documented in people as providing good and accurate care and diagnoses, and we're going to implement that as soon as we can next week. It's going to work along the following lines. Your visit actually could be scheduled like a traditional appointment over the phone whatsoever, and we'll arrange for some type of communication that we can do with a Zoom type process or a video type process. The advantages are certainly that you don't have to leave your house. You have no travel time. There'll be no travel expense. And obviously you'll have no exposure to any of the viral elements that might be lurking in the grayed out if you come into contact with other people. I was saying the great outdoors. I personally think the great outdoors is the safest place at all right now. And taking walks and getting away. I mean, we're in a pretty rural area, so walking out the front door, I probably meet more horses than I do people. So that's certainly an option to keep in tune for everybody in the family. Through telemedicine, many problems can be diagnosed or at least triaged. I mean, I think let's say Fido's coughing or has vomiting or has diarrhea. Should you bring him in? Should you wait? I don't think you should be. I don't think you should. Right now, I think the concern is let's wait because we can't get out. We can't do this. Is Dr. B open or whatsoever? I think that puts you in a really bad position. That puts you in a position of worrying about what's going on without any support. And that's one of the reasons I'm really eager about trying to introduce the telemedicine concept really quickly, because I don't want you at home worrying when you shouldn't be worrying. So maybe the pet needs to be seen, maybe the pet doesn't need to be seen, but if we insert a telemedicine type interview with digital impressions and my talking you through checking certain things on your kids at home, I think that's a significant improvement in your ability. It gives you options, and it certainly will give you the option of knowing that if it's really serious, we got to do something right away, or maybe we can dispense some medication and you don't have to bring them in at all. The term triage in people is, I think, more specific, and it's I shouldn't say this, but it probably dates me too much, but I think I learned the triage word from the old MASH TV series with Alan Alda. They would triage the patients on how they would get them into surgery. That's the real meaning of triage, is staging or sequencing things. Well, if your kid's sick at home and we can triage at home, you'll know whether it has to come in yesterday or whether it can come in a couple of days, or whether we can do medication A, B, or C for a week and see where we're at. Um, Along those lines, there are disadvantages. I'm not going to be able to solve all the problems all the time. We're not going to know what percentage we can really solve until we try it. Um, I can assure you that if we do try this and the visit becomes necessary, there won't be any additional cost to bring the kid in at the house. We discussed how to accomplish this, and we're just sorting things through one at a time. But certainly, you'll have the advantage and peace of mind of knowing if you have an urgent problem and whether or not um, the kid needs to be seen right away or not. Um, Social distancing. I, it's the new normal now. It's going to be for probably another month. I don't know if it's going to be for the rest of our lives, and the implications that it has, we're just going to have to see. We talked about keeping your pets at a distance, particularly now during the shelter-in-place thing, when you don't know if anybody that you meet been exposed or not. And for our pets, if we have visitors, pretty much the same way. So what can you do? Well, we're all in this together. We're going to be here as your support for as long as we can until they change the rules. Veterinarians are still required, not required, but special urgent services, and we're here for you. I would maintain, if your kids are on any medication, I try to maintain um, a level of probably a month's supply. Um, at the beginning of March, we increased our inventories in anticipation of some type of shortages in supplies, so to speak. We have not to date experienced um, anything other than normal back orders and the like in our ordering process. That's not to say that it can't change. Food, I would have a 2 to 4 week supply on hand. Um, and one thing that um, we started last year, many of you have taken advantage of our online pharmacy and our online food ordering. We're going to try to encourage as many, particularly Hills customers, as we can to convert over to the Hills online ordering. We've gotten assurances from them that they've actually started some price breaks um, for the near future to facilitate that. Um, and Unfortunately or fortunately, that you can't sign up for that online. You have to call the office and we can sign you up, but it's a really simple type process, and we're going to try to expedite that as much as we can for you. But ordering food at home and having it delivered certainly is an option to um, going to market and then finding what you need isn't there. If the stuff is coming directly from the manufacturer, as opposed to a third party or a fourth party type thing, they're able to maintain their inventory and support their customers as well. I've gone on for about 30 minutes here, and I want to be able to answer any questions. So if you have any questions, you can type them into the chat, and um, we'll I'll try to entertain them as much as I can. Oh, I didn't refresh my chat, so I didn't see some of your notes until now. Sorry. I thought it was alive and rolling, but obviously that didn't happen. So let me back up here. A couple of good people told me that um, um, Don said it was his first time using the program. It's new for all of us, Don, and I think you're going to see more and more things happening online. If people are at shelter in place and they can't watch their favorite football or sports game, um, I don't know if they're going to take up underwater basket weaving with YouTube videos or what, but the time is coming. Um, Here's a note from April. She said, I read that animals have different strains of coronavirus, but it's not passable to humans, though it didn't say what symptoms they are in their pets. Right, April. None of the coronavirus strains that are that have been identified and we known about for ages that dogs get or cats get are transmissible to period people. Different symptoms for different coronaviruses in different dogs. Dogs have two coronaviruses. One's upper respiratory, one's intestinal. Kitties have two coronaviruses. One is an intestinal, and one is the infectious peritonitis, none of which are contagious to people. Cheryl says she's out walking her dog. I think that's great. Me too. Stephanie's out walking their dogs, and a nice comment that they're happy to have her home. I'm happy that they're happy. Don said he's heading up to pick up some medication, wants to know if what to do, and it's best if you use your cell phone and call inside. If it's not working, pull up in front and honk your horn. No one's done that yet, but it just sounds like a good plan to me. If you have any problems, don't throw a brick through the window, but we'll help you every way we can, Don. Question about will we continue to carry food? Yes, we will continue to carry all the food, the hills and the prescription diets until I don't, well, I was going to say until further notice. I don't like that. That means I might be changing my mind. I have no reason not to do that. And we're going to maintain a supply for you as best we can. My idea about ordering at home online was twofold. One, it's convenient for you, but as more and more of our clients are ordering the hills at home, we can maintain a smaller inventory and maybe better control on it. Because the food that we get comes from a Hills distributor local warehouse. It is a Hills local warehouse, but it's my understanding that the Hills Direct program might come from a different place and have a bigger, shouldn't say bigger. I went to the Western States Veterinary Conference it was over President's Weekend, a couple weeks before this hit, which was a blessing, I guess. And there was a whole lot of many vendors, many products, many new things, many new ideas. It's a great conference to go to. But the Hills program seemed to be superior for a lot of different reasons. Once you're signed up, they actually have software that I can interact with you and create a nutritional program and monitor certain things. And the second reason that they said it comes from a warehouse that they can maintain almost, I don't want to say exclusively, but they'll ship it out from them before they might ship it out to the distributor, because you're just ones and twos as opposed to a truckload. I don't know if that makes sense. I'm not sure that really made sense to me when they explained it to you. When they explained it to me, it might all be marketing, but that's kind of the way it is. Any other questions for me, folks? This has been beneficial. I'd really like to hear what the best part of this was. If you could just type that in, that would be very helpful. I'm really considering doing this on a more regular basis, and with the crisis, if you all are interested, I'm interested in probably trying to do this at least weekly and on demand if there are things developing. Thank you, Susan. Thank you for attending. I hope the audio came out pretty good. I appreciate you all telling me that it was working, because Um, um, in my research on how to do these things, everybody says you should have a headset so you can hear yourself talking. I don't really want to hear myself talking. I can hear myself talking pretty well. And that's just a nuisance and another electronic device that's going here or going there that I'm not sure that I want to overload my already weak AT&T system. Let's see. Oh, you're welcome, Cindy. I'm happy little kitty was watching too. Excellent, Cheryl. We'll continue to keep your little fur babies in good hands. Stephanie says, helpful, great information about the teledoc. And she wants us all to stay healthy. I think that's my prayer for all of you to be safe in this time of crisis, to be with your families, and to be healthy and be happy with your pets. With that, it's Dr. B signing off. So until next time, make sure you check out these popular videos on pet care. Hit the subscribe button and the bell below to make sure you get notified every single time we post a new video like today. And hit the like button if you enjoyed and gotten anything out of today's session. I can't wait to see you in the next episode. Be safe.